Nauri, and welcome to Kiribati.
Distinguished ministers, esteemed delegates, it is with great honor and humility that Kiribati assumes the role of chair for the 36th Commonwealth Health Ministers Meeting. I trust the Minister of Health and Medical Services from Kiribati, Dr. Tinte Itinteang, who will be chairing your meeting, will be committed to fostering a spirit of collaboration, innovation, and inclusivity throughout your discussions. I applaud the choice of the theme chosen for this meeting, which is actionable solutions to building resilience in healthcare systems within the Commonwealth, with an emphasis on small and vulnerable states. The theme for this year's Commonwealth meeting calls for us to make this meeting not just another meeting, but one that we conclude with a strong feeling of accomplishment by coming up with real actionable solutions. Examples of actionable solutions to me are those that are specific and clear, attractive and easy to implement, and fun, clearly connected to our priorities or what are important to our respective countries, can be tailored to various contexts, and are affordable. Another example of an actionable solution is working closely with what we readily have within our communities, such as traditional healers. This theme is a good reminder of the principles enshrined in the Commonwealth Charter of caring for one another within the Commonwealth family. With that said, I now urge each and every member of the Commonwealth family to continue as champions of actionable solutions to building resilience in healthcare systems, especially in small islands developing states. I call upon each of you to join hands in the shared commitments to action, now urgently needed more than ever. Let us harness the collective strength of our Commonwealth family to turn challenges into opportunities and forge a path towards a healthier, more resilient future for all. I wish you an enjoyable and productive meeting, and we look forward to hearing about the great actionable solutions that will come out of your deliberations. With those few remarks, I conclude by bestowing the Kiribati traditional blessings of the Maori, the Roi or the Tapemo, which means good health, peace, and prosperity upon us all.
Acupuncture, a pillar of traditional Chinese medicine, has been practiced for thousands of years. Its benefits in treating a variety of physical and mental health issues are well documented through both empirical evidence and contemporary research. This treatment modality offers a non-invasive, cost-effective approach to healthcare, which can be particularly beneficial in low-resource settings or areas where conventional medical supply and personnel are scarce. Acupuncture practitioners deployed in these areas have provided immediate relief for pain and anxiety. Our collaboration does not stop at emergency care. We are committed to a broader integration of acupuncture within global health systems. Working closely with health ministries in various countries, we endeavor to train healthcare workers comprehensively.
Honorable Chair, Commonwealth Health Ministers, distinguished representatives, ladies and gentlemen, good morning and thank you to the government of Kiribati for the invitation to speak today. WHO's Western Pacific region includes 14 Commonwealth countries. We are a diverse region from major cities like Kuala Lumpur and Singapore to small islands such as Tuvalu. Despite this diversity, our countries share many of the same public health challenges. The theme of this 36th meeting of Commonwealth Health Ministers is an admirable one. I recently passed the 100-day mark in my term as Regional Director. I have spent these months visiting member states and listening to their needs. Time and time again, the issue of resilient healthcare systems has come up. Climate change is the biggest threat to human health and development, demanding investment in building climate-resilient health systems. Health systems that are climate resilient are those capable of anticipating, responding to, coping with, recovering from, and adapting to climate-related shocks and stress. They are ones that bring about sustained improvements in population health despite an unstable climate. Pacific Island countries and small island developing states are at the forefront of the effects of climate change. They see the impact daily on their land, their people, and their health. As the first regional director from the Pacific, I am all too familiar with these impacts: population displaced, food production affected, emerging mental health challenges, and the long-lasting effects of cyclones, typhoons, floods, and drought. However, these communities have also been the ones spearheading much of the global advocacy and action to prevent and respond to climate change, including in the health sector. More work is needed, especially to secure increased funding, improving monitoring system for disease and climate, and ensuring our communities are well prepared for future events. It will be important that health ministers work collaboratively with other sectors to ensure health impacts are considered in climate-focused programs and funding. A fundamental component of resilient healthcare systems is our health workforce, often the largest expenditure line in health budgets and our most precious resource. In recent times, many countries are facing outmigration of staff, leaving significant expertise gaps. Globally, we anticipate increasing shortages in key cadres of staff in coming decades. We need to support health workers to stay in the workforce, providing mental health support, opportunities for career advancement, further training, and conducive and supportive workplaces. At the same time, we must look at opportunities to diversify the health workforce. Many countries have volunteer, village or community health worker network that strengthen the connection between the formal health system and the community. These individuals are our eyes and ears on the ground. For many people, traditional healers and skilled traditional birth attendants are the first point of care. Countries are harnessing these traditional healer networks for health improvement. In the WHO Western Pacific region, we have a regional framework that several countries use to strengthen collaboration, improve safety, and incorporate traditional or complementary medicine within health service planning. There are many challenges facing health today, but there are also many opportunities. I trust your discussions will identify ways to leverage these opportunities and move us closer to our goal of universal health coverage and better health for all. Ladies and gentlemen, we cannot stand still. We must innovate, adapt, collaborate, and work together to ensure healthier, safer lives for the people we serve. I wish you productive discussions and a successful meeting. I thank you.